Let us now go to visual diagnosis of the limbs. The topic is tremor or spasticity. Tremor consists of a shaking, trembling, or quivering of the arms or the legs or both. It ranges from a very pronounced shaking with wide amplitude to a quiver that is so fine and so narrow in amplitude it is almost imperceptible. Tremor of the hands is more common than tremor of the legs. The cause is always liver wind, and as with convulsions, it may either be full or empty type. The former is characterized by pronounced shaking of the limbs and the latter by a fine tremor. The most common cause of tremor of the four limbs, especially in the elderly, is a combination of liver wind and phlegm affecting the channels and sinews. Liver yang rising by itself may also give rise to internal wind and tremors. Another common cause of tremors is liver wind deriving from liver blood deficiency. This is more common in women and will cause a fine tremor. Liver and kidney deficiency are also common causes of tremors in the elderly. In alcoholics, a fine tremor of the hands is caused by damp heat. In rare cases, retention of dampness in the muscles and sinews of the hands may cause a fine tremor of the hands. A general deficiency of qi and blood failing to nourish the sinews and muscles may cause a mild, fine tremor of the limbs. In summary, for tremor of the limbs, it is due to phlegm and internal wind. Liver yang rising, generating liver wind, liver blood deficiency giving rise to liver wind, liver and kidney yin deficiency giving rise to liver wind, and damp heat for alcoholics. Tremor or spasticity of the limbs is a translation of the Chinese characters Zhi Zhang. Zhi means contraction or bending of the limbs, and Zhang means relaxation or stretching of the limbs. However, these two terms may indicate both spasticity and tremor of the limbs. For observation, the patient may suffer from contraction, relaxation, or tremor of the limbs. As clinical significance, spasticity or tremor of the limbs may be due to many different patterns. Like liver wind is the most likely pattern to cause this condition in its three possible manifestations. Full wind deriving from liver yang rising or liver fire, empty wind deriving from liver blood or liver yin deficiency, or wind combined with phlegm. In cases of full wind, the spasticity or tremor of the limbs is pronounced and the patient also suffers from pronounced vertigo. In cases of empty wind, the spasticity or tremor is mild and the patient will display the symptoms of liver blood or liver yin deficiency. When wind combines with phlegm, the patient will also suffer from numbness and heaviness of the limbs. The tongue is swollen and the pulse is wiry and slippery. Epilepsy is an example of a disease usually characterized by internal wind and phlegm. The same symptoms may be caused by a general deficiency of qi and blood failing to nourish the sinews and muscles, in which case they are mild. Spasticity and tremor of the limbs may also appear at the blood level, when the heat generated by the febrile disease either leads to liver wind or depletes the yin to such an extent that empty wind is generated. As a summary for tremor or spasticity of the limbs, if it is due to liver wind, which is the full type, there will be severe spasticity or tremor with large amplitude, vertigo, and a wiry pulse. If it is due to liver wind, that is the empty type, there will be mild spasticity or tremor with small amplitude, dizziness, and a fine and wiry pulse. For liver wind with phlegm, there will be numbness and heaviness of the limbs, swollen tongue, and a wiry, slippery pulse. If it is due to qi and blood deficiency, there will be mild spasticity or tremor of the limbs, tiredness, pale tongue, weak, or choppy pulse. For liver wind, there will be a pronounced tremor of the limbs, severe dizziness, tinnitus, headache, numbness of the limbs, tics, stiff deviated or moving tongue, and the pulse will be wiry. If it is due to wind phlegm, there will be tremor of the limbs, severe dizziness, blurred vision, numbness or tingling of the limbs, tinnitus, nausea, sputum in the throat, a feeling of oppression of the chest, stiff or deviated and swollen tongue, and a pulse that is wiry and slippery. If it is due to liver blood or yin deficiency leading to empty wind, there will be mild tremor of the limbs, slight tremor of the head and or hand, facial tic, dizziness, blurred vision, numbness and or tingling of the limb, and dry eyes. The tongue and pulse presentation depends on whether there is liver blood or liver yin deficiency. If it is due to heat-generating wind, there will be tremor of the limbs, convulsions, twitching of the limbs, high fever, fainting, rigidity of the neck, epistotonus, macular rash, eyeballs turning up, clenching of teeth, dark red tongue with coating, and a pulse that is wiry and rapid. This is an acute pattern that occurs during a febrile disease, and it corresponds to the blood level within the identification of patterns according to the 4 levels. In summary, spasticity and tremors could be due to blood stasis, with rigidity accompanied by pain in joints or muscles that are worse at night. Could be due to liver and kidney deficiency, spleen and kidney yang deficiency, spleen and stomach deficiency, qi and blood deficiency, liver and kidney deficiency, dampness in the muscles, and blood stasis. Thank you so much for your attention.